Hi, you guys. Welcome back for our daily practice questions. Today, I am going on a field trip with our youngest daughter to the zoo. So, I'm just doing a few questions on all of the things bites, outdoorsy things, and pediatrics because that's where my brain is today. But I like to get into my introduction and disclaimer before we start into our questions for today. So, let's get into it. For those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, courses, videos, and more to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with a 99% pass rate on our full review since 2015 and a 100% pass rate on our one-on-one sessions since 2015. I enjoy working with all of my review students. Y'all just don't know the joy y'all bring. I always tell y'all when we're in it, we're in this together. And those of you who have worked with me know that that is true. Like we're in it together. So I look forward to working with each of you, and I hope that y'all find these videos helpful as you are reviewing. But I always like to get into the disclaimer and give the reminder that we know there's no absolute in medicine, right? We treat on a patient by patient basis, and any of these questions that I design and go over, I have created them based on the current guidelines that are being tested on the AAMP as well as the ANCC exam. When I teach on things that we are currently doing in practice, I will say that so there's no confusion, okay? So with that being said, let's get into our questions for today. All right, question number one. A patient presents to the office today with a cat bite to the left forearm. Upon examination, there's two visible bite marks to the patient's left forearm with mild redness noted. Based on these findings, how should the nurse practitioner treat? To A, doxycycline, B, augmentin, C, topical flagyl, or D, amoxicillin. Take a moment, tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first to ensure that you're answering what is even being asked of you. This gives you a moment to slow down and focus in on what's being asked, right? So here, the stem of the question states, based on these findings, how should the nurse practitioner treat? All right, so what do we have here? I always say if they're asking for treatment, run it back and see what the diagnosis is and the assessment findings, right? Because that's what we do in practice. That's how I tell you to study because that's how they're testing us, right? It's everything we do. So the patient comes in, they're talking about a cat bite to the left forearm. Upon exam, there's two visible bite marks to that forearm, and there's some mild redness. How do we treat bites? Human bites, cat bites, dog bite, animal bites. How do we treat these? And you should instantly think augmentin. Augmentin is the treatment for all bites, okay? B, augmentin. That's how we treat our animal bites. That's how we treat human bites. I hope there's no bites on this zoo trip today, but you see the theme, right? But if there's any bites, human, animal, go augmentin, all right? All right, you guys, question number 2 for today. A 72-year-old male, and it is halfway chop. A 72-year-old male patient presents to the office with complaints of red spots to the top of his head and shoulders. He does a lot of gardening and noticed these areas recently. Upon examination, the nurse practitioner notes a few dry, red areas to the patient's bald head and shoulders. The nurse practitioner inquires if the patient wears a hat and if his shoulders are covered while gardening, and the patient denies wearing a hat, and he typically wears a sleeveless shirt. Based on these findings, how should the nurse practitioner diagnose? Is it A, atopic dermatitis, B, contact dermatitis, C, actinic keratosis, or D, seborrheic keratosis? Take a moment and tell me what you got in the comments. All right, you guys. So, stem of the question states, based on these findings, how should the nurse practitioner diagnose? All right, so we're trying to diagnose, so we have to run it back and see what the assessment findings are, right? So, what do we have? The patient came in, complains of red spots to the top of his head and some on his shoulders, right? He does do a lot of gardening, and he just recently noticed these areas. The nurse practitioner observes her objective findings, right, on her assessment. She notes a few dry red areas to the patient's bald head. So his head is bald, has a few areas there, and some on his shoulder. Patient denies wearing a hat when he's out. And also, he's typically out there in a sleeveless shirt. So let's work through. So, atopic dermatitis, aka eczema. Nah, this is not. And let me just pause and say this. Y'all know, and if you listen to my derm video or taken any of my course or have my review book, I always say when you get derm questions on board, pay attention to the location they are talking about. On the ANCC, sometimes they give a few images here or there. If that, pay attention to the location on the image. If they give you the scenario, which is more common, especially AAMP, because it's a multiple choice test. But when you see these scenarios, you need to visualize where they are telling you. The location is the landmark. That is half the battle on derm, right? Think about it. So, atopic dermatitis alone, you could have started to eliminate that because we don't typically see eczema on the top of the head, right? You're typically going to see those like in creases behind the knee. Think about the location. Start to visualize what this is. Picture this person right in front of you and walk yourself through. This stuff. Half the time, we're just not seeing it the way the question is providing it. Okay. So, contact dermatitis. No, this has nothing to do with coming in contact with something and this being a result. Like I had on a necklace and there's the pattern of the necklace that left this area here due to a reaction, right? C, actinic keratosis. Yes, your best answer is C, actinic keratosis. Think about that. Actinic keratosis is commonly these dry red areas that are commonly seen in the elderly population in the sun exposed areas. This can be a precursor to squamous cell carcinoma, but you want to encourage your patients, wear your hat when you're outside, sir. Cover your arms, do all the things. If you're actively out here all the time, you need to have some type of coverage. And so, actinic keratosis is your best answer. Think about it. It's showing you bald head. He's 72 years old. He's gardening often. His shoulders are exposed. The sun exposed areas, actinic keratosis. Check out my derm video for my breakdown on all of that because I go into the whole Brittany's brilliance, because my brain, when I think actinic keratosis, I think of like AKAs, the sorority, and there's sometimes they wear the big hats, like the big sun hats, the sun visors, and I'm like, all right, you want to wear your sun visor to prevent having any of these sun exposed spots that come, AK for actinic keratosis. I don't know, makes sense for me. I hope it helps somebody. All right, and question number 3. The nurse practitioner and NP student are discussing their patient with hand, foot, mouth disease. The NP student is inquiring to clarify the virus that causes hand, foot, mouth disease. What is the appropriate answer by the nurse practitioner? Is it A, Coxsackie virus, B, parvovirus, C, the Kawasaki virus, or D, the origin is unknown? Take a moment and tell me what you got in the comments. All right, you guys, stem of the question states, what is the appropriate answer by the nurse practitioner? So here, the nurse practitioner and NP student are discussing their patient that has hand, foot, mouth, and the NP student is just trying to clarify to make sure they have a clear understanding on the actual virus that is the cause of hand, foot, mouth disease. Now, this is a knowledge-based question, but the answer is A, Coxsackie virus. Remember, hand, foot, mouth is secondary to the Coxsackie virus, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure to meet me back here. If you need any of our resources, our review book, either ebook or paperback, our review courses, our online courses, they're self-paced that you can do at your own time, that has all of our tools and everything included, or our one-on-one session, just reach out to the nursing studio. Give us a call at 803-400-6864. You can also shoot a text message to that number and we will get back with you, or shoot us an email at thenursingstudio1@gmail.com. As always, make sure you meet me back here. Happy studying. Bye, y'all.